Hi, welcome to a special edition of Tima Thursday. If you were here earlier during our little behind the scenes, you got a sneak peek at what's going to be going on today. Uh, let's wait till a few more people get in here. I see some names I know who were also here in the behind the scenes. Cool Vibes Lounge. Hello. The Real Big said, hey, how have you been? I've been great. How are you? Dreezy, you can't hear me? Can't hear me? Let's see. What about now? Can you hear me? Thank you for letting me know that actually. Dreezy, let me know. You know, I trust you. Hi. Hey, shout out to Chile. I told you I'll be international with it in here. Ooh, Dreezy said no. What about the rest of you guys? Can you hear me? Big said, that's what's up. Glad you're great. Same here. You looking beautiful as always. Okay, so it seems like everyone else can hear me. Okay, it seems, yeah, Dreezy, I don't know what's going on, but they can hear me. Thank you, Biggs. Appreciate it. Okay, so today we're going to have a special guest. I'm going to bring her on and introduce her while she's on. Let's see. All right, y'all. So let me give a proper introduction. I'm actually very, very excited about this episode because this is actually a very dear and old friend of mine, um, fellow Bronx site. Uh, you got to put up the X, we actually went to school together. Shout out to Pace Academy and fellow Ghanaian as well. But important to this episode, Ivy League educated. Y'all know I gotta brag about my friend now. Ivy League educated, Yale alumni, OBGYN, Dr. Laticias Dwomor is joining us for today's episode. How you doing, Letitia?
I'm so good. Thank you so much for the invite.
Oh
So
my
happy to
God,
be here.
I'm 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 honored by your presence. Okay, so the reason why I invited Dr. Dwomor on today was because I don't know if you've been keeping up with the little social media news, but there's a show called Married to Medicine on Bravo. One of the cast members is also an OBGYN, a Black female OBGYN named Dr. Jackie, who made some, what I find to be dangerous statements regarding Black women's health. So I'm going to play a bit of the audio of what she said so you can hear it out of her mouth, so you know why it's important to have this sort of episode. Give me 1 second here. You go to the doctor and you complain and you complain and you complain, and you're not taken serious because you cried wolf the entire pregnancy.
That ain't me, boo. I don't know what you're talking about, but go ahead.
I didn't say you. I just said as African American women, we want to also make sure you're being serious with your doctor and not playing the game so that can take you off work. Because then we see you 25 times in the pregnancy. It's hard to believe that there's a true problem when there's a true problem.
Ooh.
Okay. So, I'm not in the medical field, but just as a Black woman living in America, this is scary to know that even though this is a Black female doctor, this is how she views us when we come with our health issues. So, Letitia, you as a fellow OBGYN, how what kind of emotions did hearing this inspire?
Yeah. So thank you again for inviting me on your show. Hi, hello everybody. So yeah, it's definitely, I think the general reaction to that is many people have felt very, very hurt by the words that she used and what the sentiments behind the things that she said. And it's more important because like at this time, there's been a lot of work that people are doing about Black maternal mortality and how it's like a crisis in America. And so a lot of people are putting in a lot of work to move the needle in the right direction. And so when you have these kind of words coming out of the mouth of a very prominent and trusted OBGYN in the African American community, it sets things back a couple of steps. It kind of, I imagine that it empowers people who don't believe the statistics and who are doing things to counter all the efforts that other people are doing. And so it is definitely hurtful to hear. And I think she did a big injustice to the community by saying those words. And
I
I
will
thought, yeah.
I will say, because I I will say she did end up apologizing, but I do feel that it's important to talk about the facts, right?
Mhm,
Because just as this empowers the people that say, "Oh, it's not a big deal. This isn't
mhm.
actually happening." It's important for us to affirm that this is what is happening to our women when they're dealing with their health, especially when it comes to pregnancy and womb health,
Yeah.
right? So I will say more. You talked about the mortality rates. Can
Mhm.
you talk a little bit more about that?
Sure. So, like recent studies have shown that in general, the maternal like morbidity and mortality rates in America are like appalling compared to other countries at the same socioeconomic status. But more importantly, the rates of maternal mortality and morbidity associated with pregnancy are anywhere from 2 to 3 times more in the African American population, and it's the worst in the African American population. And the numbers show this time and time over again. There's no way anyone can say that that's not true. At this point, it is a fact. And it's a sad fact, but it is very true. And so, it's probably always been this way, but the fact that there are more women of color, more people of color in medicine, who are gaining more stature and being involved in more studies and having the access to publications to publish things that are this important. I think that's the reason why the visibility and the conversation has increased over the last couple of years. So there's no way, at this point, there's no one who can credibly say that the Black maternal mortality crisis in America is not real or is made up. And so that's why, we're all fighting this fight to like, one, raise awareness, and then two, implement actions to make that statement no longer true. And so when you hear things like this, especially from someone who is so well respected, it's definitely hurtful and damaging to the cause.
The scary part about the numbers, for me and you, because we fall right within a particularly risky group. So, and the National Institute of Health has came out with a publication that Black women between the ages of 30 and 34
Mhm.
are at an even higher risk for mortality, related to pregnancy complications. And so, yeah, we gotta, when that
And it's
time
like,
comes.
yeah. And it's like, there doesn't seem to be a lot of things that are protective. So that's the other thing. It's like, okay, well, if I know enough, if I'm well educated, if I'm this, I'm that, those things don't seem to be protective, which is very scary because you're like, what can I do then? There's the whole Serena Williams story about how when she in her first pregnancy, she has a history of blood clots. And so she was feeling, off and told her care team, hey, like I have a history of blood clots, which are basically the blood, like it kind of makes like a ball or a clot, and it can travel. It usually starts in the leg and it can travel up and kind of stay in your lungs, and it can cause you to stop breathing. You're not oxygenating and you can die. And she said, I have a history of this. I feel very different right now. I think that's what's going on. And even Serena Williams, who like everybody knows who Serena Williams is, like was not heard by her provider team until she like repetitively had to say this. I know my body and I know what's going on and I need you guys to do this test, until they did it and then found out she was right. So there's unfortunately, and it's scary, but I'm a very optimistic person, but there doesn't seem to be a lot of protective factors. But I think being aware, having a relationship with your care team, being yourself educated, being an advocate for yourself are all things that we can learn to do to better our outcomes, essentially.
I wanted to ask you, so there were three complications that I specifically saw.
Mm-hmm.
It was hemorrhage, um, preeclampsia, and
Yeah.
hypertension. So I wanted to ask you, what are the things that you see the most in your practice as complications?
Yes. So I would say the most common complication of pregnancies is preeclampsia, which is the same thing as high blood pressure. It's like high blood pressure that developed because you were pregnant. So these are women who don't have high blood pressure outside of pregnancy, but develop high blood pressure when they are pregnant. We call pregnancy induced hypertension. And it's the kind of studies that have gone on about it, assume that the cause for it is something from the placenta. The placenta is releasing some kind of hormone that's making just the way that the blood vessels are forming in the placenta are leading the body to experience hypertension while you're pregnant. And the cure for that is delivery. Typically, once you take the placenta out of the body, those blood pressures tend to come back to normal. So that's the most common thing that I see, most common thing. And it doesn't have to be it doesn't have to be deadly. Like if the patient is managed well, if we follow their blood pressures very well, if we deliver at any sign of maternal distress or baby distress, most people do very, very well. It's just if signs go unacknowledged, someone tells you, I'm having these symptoms, you don't take the steps to look at their blood pressures or do the blood work or look at the baby, then you can have poor outcomes. So it doesn't have to be deadly. It does not have to be deadly if you take the right steps as the provider.
So if you feel unheard by your provider, what would you give as advice to someone? Say it was your sister, your mom.
Yeah, that's a very good question. So, one thing that I've seen people do, which I think is very powerful, is that they'll bring a family member with them to their appointment, and have the family member be an advocate. So like this day, for example, the patient comes, they tell the doctor this one day, the doctor's like, maybe it's fine. Like, let's just keep watching it. The next time they bring a family member, and the family member can advocate for that patient, is, I know my person, and they have not been right. This is what's been going on. This is what they've been telling me at home, and I can affirm what this person is saying is true. And there's like very, very, it's unlikely that anyone will be able to ignore when someone who's so close to that patient is telling you the same things again, like, hey, I've seen this and this is not normal for my significant other. So I think bringing family members, bringing an advocate with you if you feel like you're not being heard. And then if you're able to, you can always let the office manager or wherever you're being taken care of know that, hey, like I've met with this doctor several times, I've mentioned these symptoms, and I feel like I'm not being heard. So I think definitely advocating, and family members are a strong, strong advocate.
So I wanted to ask, so as young women who don't have children but are of childbearing potential,
Mm-hmm.
uh, one thing that I hear about over and over again is uterine fibroids. And
Mm.
I also, there seems to be a strong connection with severe symptoms and
Mm-hmm.
Black women. So can we talk a little bit about that?
About fibroids?
Yes.
Yeah. So in particular, so fibroids and non-pregnant people.
Yes.
Okay. Yeah. So fibroids are what we call like benign, meaning that they're not cancerous growths of the uterus. They can either be in the inside of the uterus, in the wall of the uterus, or on the outside of the uterus. They're pretty common overall, but they seem to be more predominant in Black women. And what do we do when we find a fibroid? So one, it depends on the size of the fibroid, and it depends on the location of the fibroid, and it depends on the symptoms that the fibroids are causing. So for some people, the fibroids can cause really, really heavy periods, and that's how they're brought to attention. For some of them, if the fibroid is large enough, they can cause pelvic pain, pelvic pressure, things like that, and that may also trigger an ultrasound. And for some people, they don't have any symptoms with the fibroids. Um, and so generally my counseling about it is we always have to think about so we can always go and do recommend surgery to remove the fibroid depending on where it's located. But most of the time I do counsel my patients, surgeries have risks. Sometimes when we take out the fibroid, let's say if it's deep enough, you may not be able to be a candidate for vaginal delivery ever again. That means that every time you become pregnant, we have to do a C-section. So it really, really just depends on what kind of symptoms you're experiencing and if the fibroid is affecting your quality of life. If it's affecting your quality of life and we have a solution to it, why not? Why shouldn't we implement a solution? But if it's something that's small that we can watch, that's not interfering with your ability with your periods, with your daily function, with your ability to become pregnant, I think it's usually reasonable to watch it. And then if it becomes symptomatic or problematic, then manage it accordingly. Yeah.
So, do you think fibroids are linked to a lifestyle? Are there lifestyle things that affect fibroids?
Yeah.
Because I do see the disparity
Mm-hmm. Hmm.
racially. You're
Right.
speaking.
Definitely, they seem to be more common in Black women, but all women of all races also can have fibroids as well. I think usually what we hear about in terms of the disparities is like how the fibroids are managed, where a lot more Black women tend to have more invasive procedures for their fibroids, such as hysterectomy, like getting their whole entire uterus taken out, as a management option for the fibroids instead of offering them the whole spectrum of treatment options available. I haven't really encountered. I know there's a lot of studies out there, but nothing that has any robust backing in terms of what lifestyle or things people did or didn't do that caused them to have fibroids. So right now the data is not super clear, but definitely it's a very hot topic, and it's something that people are constantly researching. Yeah.
Okay. So me personally, I'm on this whole mind, body,
Mm-hmm.
spirit thing for the new year. So,
Mm-hmm.
um, what are some suggestions you can give me just as a young woman? Well, yeah, young lady, I should
Yeah.
say, young lady. Just as a young lady to make sure that I'm healthy.
Yeah. I think That's a very, very good question. So I saw you were doing a water
Yes.
fast recently. How did
Mhm.
that go?
That it actually went really
It was
well. I
good. Yeah.
noticed a lot of like I had a lot of bloating before I
Mm-hmm.
started, and that completely went away.
Mm-hmm.
Now I'm like back to eating, but I'm eating like raw veggies.
Mm-hmm.
So would you say like stuff like that, making sure you up the vegetables and stuff is
Yes. Yes. So I was reading a little, I was like, because I saw one of the topics was womb health, and so I did a quick literature search to look for it. It's really all those things that we recommend to be healthy. So regular exercise, eating as clean as possible, making sure that your diet is well balanced. You have all the nuts, the seeds, the protein, the healthy carbohydrates, all of those, healthy exercise, and also good like mindfulness as well. Like being mentally well is super, super important and super underestimated. Making sure you're sleeping well, staying hydrated, like you're giving your body the nutrients and resources that it needs to function appropriately so it doesn't like start turning on itself, right? And so all those things are super, super important and easier said than done. But I think making that commitment of like really enriching the body and giving the body what it needs to not only survive but to thrive is a very, very important goal for the new year and beyond. Yeah.
just a side note, when I asked before about lifestyle stuff
Hmm.
and the fibro, I can't help but to think, because don't they grow back after surgery?
Yes. Yes. They can grow back. So like kind of like the science behind the fibroid is that it is basically one of the cells that make up the muscle tissue of the uterus that just grows. For some reason it just grows and grows and grows and grows and grows. It like clones itself and it grows. And so as long as some of those like kind of aberrant cells are present, they can definitely grow back after surgery. Yeah. And that's
The
something that we
reason
do
the
find. Yeah.
reason I brought that up is
Hmm.
because I talked about like stress management.
Hmm.
I tend like I think a lot of things are connected to stress, or
Hmm.
our way of managing or not managing our stress.
Hmm.
So I think that's something that's so important, especially for our
Yeah.
community, because I don't see, and I guess part of it is that people don't have a lot of time. So they
Hmm.
feel like, okay, I can't spend the time to do a 20-minute meditation or do
Hmm.
an hour of yoga.
Hmm.
Um, so I think it's like probably the biggest thing that I hope that women get from this is make some time for yourself, because if you don't, your body won't forget it, and at some
Yeah.
point it will break down.
And Fati, you're so right. Because there's been some studies that have come out recently are saying that like sometimes when like the stresses that our mothers or grandmothers went through can be passed down to us, can affect how like we function and how we respond to certain stressors in the environment. Like it gets imprinted in our DNA, like in the eggs, like before we're even born. So, and that's like fascinating data that like things that your ancestors experienced, and of course, why from our history, why wouldn't that be a thing that plays an important role? That stresses that your ancestors like um, experience can affect like generations down, like so many generations down the line, just through DNA changes. Yeah.
Exactly. Like, if you know how sometimes, let's say if the kid's grandparents were great dancers, the kid just automatically knows a beat. Why would
Exactly.
we think that everything else is
Would
different from that?
not exactly. Why would other things, good things are passed down and bad things can be passed down too, unfortunately.
And
Yeah.
it's especially because a lot of us come from socioeconomic
Mhm.
situations that aren't
Mhm.
the most ideal. It's
Right.
especially important for us to find a really, really good way of managing our
Mm-hmm.
stress, not only day to day, but the
Mm-hmm.
stress that has built up over time.
Over time. Yeah. Yeah, absolutely. Absolutely. And I think another thing that in terms of like wellness is, and I've been thinking about this, like, is for us as like young people coming up as young women, like I know like the healthcare system is so it can be so messed up in so many ways, but there really is a generation of young physicians and young doctors who are learning and like are more aware of all, you know, the social determinants of health, these health disparities, these outcomes. And that's how they're teaching us in medical school now. So I think it's so important to find either a primary care doctor or an OBGYN that you trust and build a relationship. Build a relationship from going to your annuals. From annuals, you get a lot of education. You have a chance to talk with a healthcare professional. It could be a midwife, it can be an OBGYN, it could be a nurse practitioner, it could be a PA, someone who you identify with and who you trust, who is certified and is up to date on the latest information, and build a relationship with them over time. So it's almost like embracing the healthcare system for your own advantage and like really owning that relationship so that you're not only being seen in these with these people in like a setting of like vulnerability,
Mm.
but you can like be empowered that okay, like I know this doctor, they've seen me since I was 23, 26 years old, and now I'm having this issue. They know who I am, they know what I do, they know me as a person. And I think that kind of empowerment and relationship with a healthcare provider that you trust goes a long way in terms of feeling satisfied with the care that you're getting as well, and also feeling safe as well.
And not just on the patient's end, but I'm sure after seeing you and building that relationship on the physician's end, they're like, oh no, I know Letitia, she's not like that.
Exactly. Exactly. Yeah, there's like certain patients that I know I'm like, as soon as they tell me something, I'm like, if she's telling me this, there's something up. Like there is something going on. So it really does help. It goes both ways a lot. And so I do like charge us to really, really take ownership of our health in all the different ways, but also learning how to like embrace the medical community and really take ownership of it instead of being kind of bystanders. Yeah.
Yeah, because I think just because of how history has played out, a lot of us have a fear
Yeah.
of doctors and
Yeah.
physicians.
Absolutely.
And we have reason, but like you said, now with I mean you, of course I'd feel comfortable, right? You're a girl just like me, you know?
Yes.
Um, so I want to thank you so, so much for blessing us with your presence.
Aw. You're so welcome. Thank you so much for having me, and I hope that people were able to learn and taking something out of this conversation.
And I'll text you after this.
I
And
know.
oh, we have to hang out. We talked about September and it never
I
happened.
know.
So we have to
But
we
you know,
have to
this
make
whole
it
time
happen.
we do have to. This whole time I've been talking to a black screen. I can't.
I don't know why. So when you first came in, you saw me, right? But
First
then
thing,
when
yeah. And then the thing is, as soon as I end the live, I'll see that there'll be like 5 seconds of me and you like up and down, but then that will be it. Yep.
uh,
So
it, well, that's how technology is
I
imperfect. But
know.
I'm so thankful for you gracing us with your presence, and I shall see you later tonight.
Bye.
Bye.
Bye, everyone.
Oh, I'm not touching my screen. All right, y'all. I hope y'all got something out of that. Um, I really want to thank Dr. Dwomor for taking time out of her busy schedule. Now, we're going to talk about what I think a lot of people have been talking about, which is the Cat Williams interview. Did you see it? Did you watch it? Did you see it? Did you watch it? um, he dropped a lot of bombs, but what else did we expect from Cat Williams, right? I think one of the most like, well, this was pretty funny, but that, thank you. Travel said that was a great interview. Thank you. I appreciate it. You know, I try. Hey, okay. Fort Worth coming with them fire emojis. You know. I'm trying. I want this show to be entertaining, but I also want it to be informative, and I want to focus on our issues. So I thought it was really important because while I saw a lot of people uh, talking about this topic since those statements were made, I didn't see a lot of people spinning it on its head, right? Like, okay, misinformation was put out there. Let's put the right information out there and try to minimize the damage if we can. So appreciate that. Appreciate that. But back to the Cat Williams interview. What? Big Miss New York? Talk about it. Talk about it. Okay. I do not know how to say your name. I'm gonna just say GH said lock in from Guyana. Shout out to Guyana. The Guyanese community out there. Y'all be holding me down heavy. Shout out to Ghana too. You know what's crazy? Not every time, but sometimes when I tell people I'm from Ghana, they think I'm saying Guyana. Uh, but I know a few Guyanese people, okay? Uh, but y'all, I feel like I remember the joke he was talking about, but I think Shannon Sharp did a great job during that interview with actually playing Cat Williams' joke and then playing Cedric the Entertainer's plagiarized joke. I think it's pretty sad. Let's see. We're gonna let that go. We're gonna let that go. I said I love that dress on you. Thank you, thank you. So let's see. I'm looking at that phone like I usually shut off my phone, my other phone, before I start broadcasting. Okay, Vita said you are even more radiant today. 2024 loves you. Thank you, thank you. What's up, Vita? I hope you're having a great start to your new year. Uh, but yeah, Cat Williams came and shut it down. And blessed all the content creators, right? Because nothing was really happening in the beginning of 2024. But hey, we got our first like big thing to happen. I thoroughly enjoyed the interview. He was funny, even though it seems like he was just kind of being off the cuff and talking, but he was funny even then. And yeah, I will say some of the stuff was like, I think in any industry you get things like that. You get people who will say take your joke or take your saying, right? I think even content creators deal with that, right? You might have a thing you're known for saying, and then you're watching YouTube one day and now this person is saying it. Okay, they must have watched you. It's a thing. I think it just speaks to that person's character. I just like I'll say for me, I try not to take it to the heart, because I know what that is, you know. Try not to take it to the heart, but I can definitely understand wanting to set the record straight. I think anyone would want to. So, yeah, if you have not seen that interview with Cat Williams and Shannon Sharp, I think you should. Okay, y'all, it's been an eventful show, and I will catch y'all on Tuesday. Y'all know I'll be having stuff coming out, so then I'll have y'all get some content. But I'll talk to you at another time, everybody. Y'all know what I say. Stay safe and stay blessed.